nation's lawmakers. In fact, they're holding more than 20 town halls across the country today. With me now live, Democratic Congressman from Maryland, Elijah Cummings. Congressman Cummings, good to see you again.
It's good to be with you.
Congressman Cummings, what did you make of the town halls that are going on across the country, including the president's visit to New Hampshire and Arlen Specter's town hall in Lebanon, Pennsylvania yesterday?
Well, I think it all depends on where the media takes their audiences. My good friend Hank Johnson of Georgia just had a town hall with 2,000 people and not one peak of a problem. I held a town hall about a week ago with veterans dealing with health care and veterans issues, and you would have thought that it was a good meeting. We had no outbursts. They had concerns, and we were able to share our thoughts. I think, and with regard to the president, I think the president did exactly what he needed to do yesterday. I think he laid out the problem. Basically, there are two arguments that we've got to deal with. One, the moral authority of this nation. Are we going to take care of the 47 million people, and sometimes call it up to 68 million per day that have no insurance, and so many more that are underinsured? And the other argument is, how do we revise our healthcare system so that we are effective and efficient, period, and get these people insured? And so I think the president attacked both of those problems. But again, I think some of the folks who are coming out are trying to drown out folks who may have legitimate concerns and people who simply want to listen. I've done a lot of town hall meetings over my course since I've been in office for many years. And I can tell you, I always have people that may not agree with me, but they don't drown out the people who want to be heard and who want to listen.
Congressman Cummings, I want to actually switch the topic. The New York Times had a lead editorial today talking again about the money that Wall Street seems to be making, again, the bonuses that they plan to hand out as well. I know you've been outspoken on this issue. Your feelings seem to be that part of not just seeing the economy recover, but rebuilt in a very different form and fashion is affecting some meaningful pay gaps. But it seems like it's not really moving forward. It seems like every time we hear about that, we read a new article that says that people have found a way around it, and that in fact there may be a new bubble. They're saying that the stock market, because of over inflation and because of the willingness to pay people a ton of money, again, that we're creating new problems. Is there any sense on your part that Congress is going to implement meaningful pay caps for executives, especially those on Wall Street that have received government money?
I'll tell you, if it's up to me, we will. I just don't know how much of a stomach that Congress has to do that. In talking to a number of my colleagues, they seem to think that maybe this thing is a bit out of control, and it's going to take the Obama administration and the pay czar to work with us to try to control this. Let me tell you something. We can't continue to go back to where we were, where people were getting these bonuses that were basically not really connected with success, and encourage these kind of bonuses that encourage people to take phenomenal risks. And we seem like we're walking right back into that. So I think when the Congress comes back, Carlos, we're going to be working to try to address these issues. But again, it's hard to say exactly what the Congress will do because we're so caught up right now in this whole health care situation.
Congressman Cummings, I'm joined this morning by my guest co-host, Angela Burton-Murray, the editor-in-chief of Essence, who's got a question for you.
Hi, Congressman. Recently, you released a report on women in health care, and taking a look at the very real issue that families are facing. We have more than 64 million women who have lost health care due to loss of job or a spouse that has lost a job. How do you see the administration's plan being more able to effectively address this issue for women and children in this country?
Well, one of the things that, and I'm so glad you raised that, one of the things that we, in that report, it talks about women, for example, who may be baby boomers and maybe say, for example, 5 years older than their husbands. The husband gets to be 65, it goes into Medicare, and guess what? If that wife has been dependent upon him, and there's a whole lot of people that fall in that category, they have no insurance. Basically, and they have something else. They have probably pre-existing conditions, which means that if they had something like breast cancer, scared with breast cancer, they would not be, if they had $100,000, they wouldn't be able to buy a policy. And so basically what this, the healthcare reforms addresses that issue and says no more pre-existing conditions banning people from getting insurance. It also would bring gender equity. I don't know if a lot of people know it, but if you have a firm with a lot of women and then compared to what a firm with a lot of men would pay, there is a vast difference, like up to 45% that will be paid for the women's policy as opposed to the firm firm with the males. So therefore, a lot of women are then discriminated against because if somebody's hiring, they're going to say, wait a minute, I don't want too many women because my insurance will go up. Well, the president's policy, well, the policy that we're working on would get rid of that gender unfairness. And so there are a number of issues. And then the other part is that there are more women, a higher percentage of women who depend on men, even in this day, for their insurance. If a man loses his job, and we've got millions losing their jobs, then what happens? She has no health insurance. And so this would, again, would bring the cost down so that they could get that insurance.
Congressman Cummings, thank you so much for joining us, and look forward to having you back again. In fact, as I often say, would love to see you here in New York live on the set.
I'll do that. I'll make sure we make that happen.
Look forward to it. We want to hear